You put people first. You can find the streams on TaylorvilleDailyNews.com's Facebook and WTIM TV YouTube. Before we start today's interview with Pana Community Hospital, Dr. Andrew Ott is a foot and ankle surgeon at Pana Community Hospital. I wanted to make the announcement that the area emergency management services, they are suspending the tornado test for today, the tornado test siren for today, first Tuesday of the month. Also a chance for severe weather today. So if you hear the severe weather siren today, it is actually severe weather and not a test. All right, now that we've gotten that taken care of, Dr. Andrew Ott, foot and ankle surgeon at Pana Community Hospital, welcome in.
Thank you.
So tell me a little bit about yourself.
So I actually grew up pretty close to Taylorville. I grew up in Hillsboro, Illinois, so most people know where that is. If you live in Taylorville or grew up in the area, that's probably only 40-minute drive south of the Taylorville area. I grew up hunting and fishing. Grew up in a rural community right outside of Hillsboro. Spent some time in Hillsboro. Also lived in Fillmore in high school in that typical area. So we did a lot of hunting and fishing and those sorts of things. In high school, I did play a lot of sports. And that's one of the main things that got me into wanting to specialize in the lower extremity. Playing sports, I always seemed like I had some sort of foot and ankle injury. And, there really weren't a lot of people around that specialized in that. So that got my initial interest. So I played football in high school, wrestled in high school, and also played baseball. And I also ended up playing football in college at Blackburn College when they did have a football program there. They've since ended that program, so it doesn't exist anymore. But when they did have one, I played. So I went to my undergrad at Blackburn. That's in Carlinville, Illinois, also pretty close. Went to medical school at Des Moines University. That's Des Moines, Iowa. And then ended up doing residency in New York City. And afterwards came back home, worked through Hillsboro Hospital, and I'm contracted to work at Pana Community Hospital.
When is at Pana Community Hospital, what are your duties?
So as you mentioned, I specialize in the lower extremity. So really any injury below the knee, that could be any gruesome traumatic injury, major dislocations. I could do anything from a hammer toe surgery to a bunion to an ankle dislocation, fracture repair. I'm also a board certified wound specialist. So I'd say approximately 30-40% of my practice is devoted strictly to wound care. So we see a lot of patients with wounds, and people are like, well, what exactly does that mean? So really any injury to the skin or the integument, open sores, injuries that, you've had a laceration, maybe that didn't heal, diabetics and things, typically they lose the sensation in their legs and feet and develop wounds and sores that have difficulty healing. So I see a lot of those patients as well. Also here at Pana, since 2019, I've served as their chief of surgery. So that's a little bit of some administrative duties that I perform over here as well. And I serve as the advisor to the surgery department as well as just their general medical floor at Pana Community Hospital.
I want to talk a little bit more about your chief of surgery duties in a moment, but first I wanted to ask, what of the lower extremity below the knee injuries do you see the most often?
It's probably going to be ankle fractures and dislocations. That's a common injury that, maybe an athlete would get, or you could see that even in car wrecks or just simple slips, trips, and falls, which are common, especially in the winter months. So I would say ankle injuries for the injury section. And then for just elective stuff that people come in for that are wanting surgery on, I would probably say bunion surgery. So that's kind of a bump or protrusion there by the big toe joint that's bothersome and affects people wearing shoes and walking and those sorts of things. So I'd say those are probably the two most common things that I see on a weekly basis.
Mm-hmm. Well, when I think of ankles sometimes, Dr. Ott, and sometimes I think, okay, well, it could be that I kind of just stepped on it weird and it could just be twisted, right? But oftentimes that might not be the case. Do you have a tip for athletes out there that need just a quick test, like is this sprained or is this busted or dislocated? I think actually if it's dislocated, you would probably know, but you know what
Yeah,
I mean?
obviously
As
that
far as
would,
fractures versus a sprain.
yeah, dislocation, you would obviously know, you'd see some deformity there, but if you have, sort of that inversion injury where your foot turns inward, you step in a pothole or you step off a curb wrong or you slip on, a wet deck or something like that. Typically, a quick way that you could determine whether, it's serious, number one, do you have point tenderness directly over the bone there on the ankle? So there's a very prominent bone on the outside of your ankle as well as the inside. When you're pressing directly on that bone, is it tender? That would be a good indication that you may want to seek further care. Um, at a minimum, get some X-rays. And then the second one would be, are you able to walk on it? If you're able to walk on it, the pain goes away, and you're improving, then it might not be as serious. But if you're not able to put weight on your ankle and you're having difficulty walking, then it might be a good indication that you've had a more serious injury and might be something you want to seek further care for. And like I said earlier, at a minimum, just get some X-rays and just rule out that you don't have a more serious injury.
Yeah. Well, going back to your chief of surgery roles, what are your duties when you have your chief of surgery hat on?
So I'd say the biggest thing that I do from an administrative standpoint in that regard is anytime you're a surgeon, you just don't approach a hospital and say, I'm going to start operating here. There's policy and procedure that has to take place first. Number one, to make sure you're competent in performing those surgeries. So what a new surgeon would do if they're going to apply for privileges at Pana Community Hospital is we have a big packet that gets worked up before it even gets to my desk, where the administrative assistants will go through their education history, and they will probably even request surgical logs if they've been working at different hospitals. So they would be required to submit evidence of every surgery they've performed, maybe over, we might request maybe the past 6 months or the past year, and they would submit that with their paperwork. They would also submit, any board certifications that they might have. So their certificates, obviously they're going to submit their diplomas, letters of recommendation, those sorts of things. I'm going to review all of that, and we're going to make a determination with the chief of staff of the hospital and determine whether we think, it's safe for these surgeons to perform, their requested surgeries here or not. Are we going to place any limitations on them? Are we going to, give them a period of, more of a focused review type thing? Are we going to monitor, certain cases that they're doing, make sure they're proficient at doing those? So there's multiple things we can do, but for the most part, from my standpoint, it's they submit, their case logs, they fill out a form saying what they want to do, and then I will, with the chief of staff, sit down and we'll review that file and determine whether we think that we're going to allow them to have those surgeries here or not.
Well, I'm glad you brought up board certifications. I understand you are board certified in a number of categories. What are those certifications and what does it mean to be board certified?
Yeah, so I can see how that could be, some confusing to the public. I don't know that they even know what that means or if that's important or not, but I would urge that, if you're a patient out there and you're considering seeing a specialist, yeah, in my opinion, definitely if you're going to see a surgeon, I would recommend you see one that it has been boarded by whatever, if it's going to be orthopedic surgery or general surgery, plastic surgery, you may want to, look into their education history, see if they do have board certifications in that regard. Basically, what it means is when you're in residency, you're doing surgery under, what they call your attending surgeon's license. So you're not board certified at that point, but that surgeon that you're performing the surgery with likely is. When you graduate Hospitals, the public really have no way of determining, are you proficient at doing this surgery? We know when you're, a resident, you were proficient, but you were also directly supervised by a surgeon who was most likely board certified. So what happens when you graduate is there's a rigorous process where you have to actively accumulate surgical cases. So maybe over that first year, let's say you do 200-300 cases, you have to log them into the system for whatever board you're going to apply to. Say it's the American Board of Orthopedics. You're keeping a very careful case log. And after you accumulate a certain amount of cases in each set category that they want you to have, the board will then review those cases with a fine-tooth comb. They will determine whether they think you're doing them correctly or not. And then you will have to take an examination where you actually have to sit down. And then, and often in most board examination process, you'll also have to sit down in front of a board. Some boards have gone away with doing that, mostly through COVID and things. Well, they actually have to sit down in front of the board and you'll have to answer their questions. Why did you do this? Why did you do that? So if you pass that, if you pass the written examination, if you've done enough of the cases in certain categories, after that point in time, they'll determine whether or not to make you board certified or not. So it is very important, I think, for the public to know, what that means. And when your doctor says he's board certified, it is important.
What are your certifications, really quick, before we head into a timeout, Dr. Ott?
So I actually held 4. Like I said, your doctor may not have any, so it is important to look for that. So I hold 2 through the American Board of Foot and Ankle Surgery. That would be a board for just plain foot surgery. There's a board for reconstructive rear foot and ankle surgery. And as I mentioned earlier, probably 30-40% of my practice is devoted toward wound care. So I do hold the highest board certification possible in the United States for that. It's the American Board of Wound Management. I'm a certified wound specialist physician. And I also hold a 4th board through the American Board of Podiatric Medicine.
That is Dr. Andrew Ott at Pana Community Hospital. He's a foot and ankle surgeon and also the chief of surgery here at Pana Community Hospital. Your stream on TaylorvilleDailyNews.com's Facebook and WTIM TV YouTube, brought to you by Landmark of Taylorville. You'll always do better with Landmark, and People's Bank and Trust. They put people first.
WTIM. Your information station, WTIM.
This is the WTIM Morning Show. I'm Avery Cooper, your host. Your stream brought to you by People's Bank and Trust. They put people first. And Landmark of Taylorville. You'll always do better with Landmark. I have foot and ankle surgeon at Pana Community Hospital and chief of surgery, Dr. Andrew Ott, on the phone. And before going to break, we talked a lot about some of the certifications and the qualifications of Dr. Ott. But let's move on just a little bit. We also talked a little bit, Dr. Ott, about some of the things, some of the ways you can tell if you are hurt. And I think going along with that line of thought is we oftentimes, as people who are suffering injury, we try to downplay how much we are hurt. And so I want to know, Dr. Hunt, what are some of the big mistakes that people experiencing lower extremity injury or pain often make? What are some of those big mistakes?
Probably the biggest mistake that I see day in, day out, dozens of patients every month, or you see, like you mentioned, let's just say you have a general foot ache or foot pain on your heel or your ankle's been hurting. You tend to walk on it. You talk to your neighbor, they recommend you go to this shoe store, that shoe store, buy this, buy that. By the time you get in here, it might be 4, 5, 6 months, hopefully not 1, 2, 3 years. The longer you let that go on, the more difficult it is for me to get you better. And along with that is you don't want to spend hundreds and hundreds of dollars on these things that most of the time, when you're buying them yourself, they're not the right shoe that you need. They're not the right brace that you need. They're not the right arch support that you need. So you're spending lots of money when, if you just made that 20, 30-minute appointment, within 15 minutes, I could tell you yes or no, that's going to be good or bad for you, specific for your foot type and the way you walk. Usually the person at the shoe store doesn't have that degree of training that can determine that. So I'd rather you see us first so we can tell you what to buy rather than you go out and waste a bunch of money.
That's interesting that you bring that up too, that just a visit could be the solution to all your problems, because it seems like a lot of what you do, Dr. Ott, focuses on surgery. But it sounds like what you're saying now is that you also have other options outside of surgery. What other options do you offer? Non-surgical options to treat lower extremities?
Yeah, absolutely. I'd say number one, I try to avoid surgery at all costs, and I would say 99% of my patients, I'm going to try everything single thing that I can to get you better without going to the operating room. Whether that's you require an injection, like we mentioned earlier, a better shoe, a better insole, a better sandal. Are we going to put you through physical therapy for 2 to 3 months? We're going to take, if we need an X-ray, if we need an MRI, if we need ultrasound, we're going to try everything we can to get you better before surgery. And like I mentioned before, the majority of patients don't require surgery. And oftentimes, I feel like a lot of surgeons rush to surgery and they can get you better, with doing some of the things we just mentioned.
That is Dr. Andrew Ott at Pana Community Hospital. He sees all ages and commonly sees patients who have had several surgeries performed by surgeons, but also he can come in and if you're experiencing any ailment, he can go ahead and check you out. Thank you so much, Dr. Ott. I really appreciate it.
Yep.
Your stream brought to you by Landmark of Taylorville. You'll always do better with Landmark. People's Bank and Trust. They put people first.
WTIM.